areas of society that we previously deemed to be impenetrable, like the military, have been ravaged by mental health problems. And individuals who we thought of as the epitome of resilience are ones who are openly suffering from mental health problems. Now, I conducted some user interviews and found this is a problem that many people face daily. In particular, people struggle with actually getting the right kind of mental health care because the process is difficult to do and to succeed with, and overall the process is inefficient. Some of the findings from these interviews and from market research were that people just overall aren't willing to discuss the problems they're facing. The stigma associated with getting mental health treatment is off-putting to many people. In addition, misdiagnosis is highly prevalent in mental health care. For instance, bipolar disorder patients are initially misdiagnosed for an average of 7.5 years before they're correctly treated. And the prevalence of comorbidities in mental health is actually making diagnosing and treating mental health more and more difficult. In addition, the specialty mental health care is actually unaffordable. Cost is a common barrier associated to preventing people with using mental health services. And in addition, if people have insurance that covers mental health services, the rules and guidelines that are associated with that insurance's governing of mental health services is virtually unknown. More than 90% of people don't know how their insurance actually covers mental health. And lastly, and overall, mental health is just inaccessible for those who need it. Travis County, like many other counties and municipalities, offers Medicaid users mental health services. And while these mental health services are probably pretty good, they actually have a wait time of over 21 days, rendering them virtually ineffective. Now, they actually, like, these problems have a real economic toll as well. $1 trillion is lost from ineffective and inefficient mental health care per year worldwide. That's derived from one poor mental health day a month being linked with a 1.84% drop in per capita income growth rate, about 12 billion days of productivity lost per year, and in the US alone, untreated mental illness costing $300 billion annually. So our solution is actually an AR/AI virtual therapist. This virtual therapist exists as a web application, just like a plugin on a normal site. It is conversational with the user in order to build a rapport with them like a normal therapist. It's free for the user. It's accessible anywhere that there's internet and available 24/7, and uses deep learning to ensure the accuracy of any of its insights while also being able to identify comorbidities. This solution is tailored to actually solve the issues that people face with getting mental health care in the status quo. So when I use the term virtual therapist, many people assume that we're actually making a medical diagnosis. That's incorrect. Really what's happening is we connect users to the right kind of care, like a triage system. We like to call ourselves a behavioral health search engine. So take this user process, for instance. On the left, you see that if a user is having a mental health issue, we could use their verbal remarks and their subtle behavioral cues to actually verify the existence, type, and severity of mental illness. Based off of the existence, type, and severity of mental illness, we can then direct the user to a treatment or rehabilitation center, telemedicine application, or behavioral health professional, for instance. Take, for example, someone who's struggling with OCD. They're having an OCD attack. And the virtual therapist talks to them, figures out what's going on, how severe their OCD is, and based off of that, can actually connect them to the right kind of care. So we've actually had a lot of initial traction with this idea so far. We've partnered with a company called Voy, which produces a proprietary software that actually identifies suicide ideation 95% faster than the industry standard. And so with voice technology, we want to inject that into our own technology so that we can ensure that users who use our virtual therapist are actually staying safe 100% of the time. We've actually also had a lot of response with cold calling researchers to actually help us clinically validate our product. We've been communicating with Dr. Carolyn Rodriguez at Stanford University, Dr. Min-Kyung Lee at UT School of Information, and Dr. Katie Donneville at UT Health San Antonio, as a way to actually collaborate together to prove the efficacy of our product. In addition, we've had a lot of preliminary conversation with Kaiser Permanente in Northern California as a way to also clinically validate our product. And lastly, the University of Southern California actually built a flushed out version of a virtual therapist. Their virtual therapist is more tailored to research. And while it is not the best product market fit at the moment, it is definitely something that we would actually strive to one day license. Initially, we want to focus on actually building an MVP before we actually license their virtual therapist due to the overall cost. So after we validate our product, we actually want to sell directly to organizations. Here's a list of the actual organizations we'd like to sell to. Examples being the VA, governments like Travis County and other counties, insurance companies, and universities in general. All these types of organizations struggle from the overall number of people who actually need mental health care. So for us, the value that we provide to these organizations is that we can help triage and screen their constituents for mental illness and actually direct these constituents to the right kind of care so that these organizations are using their mental health resources most effectively while also being able to track trends of their constituents over time. If they see a huge uptick in depression, for instance, then they could hire more depression counselors. So the overall market for behavioral health and mental health is actually huge, and it's growing. Ackerman reported that's a $240 billion global market, and it has a 2.5% compound annual growth rate. Of that, about 143.3 billion is in the US, and what we're really focusing on obtaining is the $16.8 billion telemedicine and psychologist market, with the VA and with Medicaid users being about 10 million plus. So we really think we can capture a lot of that market share by providing a more effective route for people getting treatment. There are some potential competitors in a market this big. We've actually classified our competitors into two types of categories. The first is the technology competitors. Replica.ai and Samsung have built a virtual human type program. Now, these virtual human programs that they've built, while they are very impressive because you can actually converse with the user, they don't have any behavioral health capabilities at the moment. So we don't really see the whole competition with them at the moment because their product is solely an adversarial chatbot. However, on the other hand, Quartet Health and Lyra Health are focusing more on behavioral healthcare and mental health care and getting constituents the right kind of mental health care. The issue with Quartet and Lyra, though, is that they're focusing on more outdated ways of actually triaging people to the right kind of care, like questionnaires and chatbots, which have been proven to be ineffective overall in getting people the right kind of care because people aren't willing to talk to a chatbot. They'd rather talk to an actual person or an adversarial chatbot like Replica and Samsung. So I'm joined right now by two advisors, Stephen Smith and Thomas Hart. Stephen's the CEO and founder of NoCD, which is a venture-backed OCD treatment application. And Thomas Hart is an Air Force data scientist who's an entrepreneur himself. My experience is that I've actually led an Air Force program that used technology and leveraged technology to treat PTSD. So together, we actually make a very capable and very complementary team that can solve this problem. Here's our next steps. So initially, we want to focus on actually developing the MVP. We think this will take about 9 weeks and cost about $16,000. Particularly, we want to focus on building out a natural
2 minutes left.
Okay, thank you. Particularly, we want to focus on building out a natural language processing MVP first. This would take 6 weeks, about $6,500. And then after that, we want to focus on building the computer vision MVP, which would take 9 weeks and about $9,500. These would be run concurrently so that we can use our time most effectively. After that, we actually want to focus on developing the behavioral health side of it. So the triage system, like I talked about earlier, the search engine capability. This takes 3 weeks and about $4,000. And this is crucial to the development because no other competitor and no other person in our space is actually focusing on triaging people to the right kind of care. After that, we want to partner with the aforementioned researchers to actually test the product efficacy. It's crucial for us to test the product efficacy because all of our users and all the preliminary conversations I've had with potential customers have cited that product efficacy is the most important thing for them going forward. This would take about 6 to 8 months, and the cost of this would be $0 because we're going to jointly apply with these researchers for grants to cover the cost of actually conducting these efficacy trials. And while these efficacy trials are running, concurrently, we can actually conduct preliminary consumer testing. When we're conducting these efficacy trials, we want to focus on testing the efficacy of the underlying algorithms that are using deep learning to gauge the insights with mental health. But with consumer testing, we want to focus on the actual user experience. This would take about 2 to 3 months, and we don't have a specific cost in that yet. So with that, I thank you for listening to me, and I open the floor to questions.